Thank you all for coming and joining us this morning. It is a good morning, and it's great to be home and surrounded with all these docs here. I'm kind of reminded that there are a number of these folks in white coats helped me making a recovery from a broken collarbone. So thank you for your expertise, and Dr. Malone, who's done some great work in that case for me. But we do have great doctors in Texas. Being the son-in-law of one of those for some 20-plus years and being associated with him, I have a very personal and loving relationship with that profession. But we're here today to discuss a wide-ranging national conversation, one that's been contentious at times. It's been downright confusing for a lot of folks across the country, a lot of folks who want answers, people who come from both sides of the aisle, choosing to argue any number of perspectives for the search, from the search for a moral imperative to the types of procedures that will or won't be allowed. I mean, it's been a really interesting discussion. But today we're here to discuss the issue from a baseline perspective that everyone can understand, asking and answering simple question: what will the options being considered in Washington cost Texas? The legislation currently being considered not only poses a serious threat to patients and providers, it'll cost Texas taxpayers tens of billions of dollars over the next 10 years alone, without significantly improving care for Texans. The starting point for today's discussion is a report from the Texas Public Policy Foundation. And to help get the ball rolling on that, I'd like to introduce the President and CEO of the Texas Public Policy Foundation, an individual I have great admiration for, intellect and otherwise, Brooke Rollins.
Thank you, Governor Perry, and I thank you for your continued principled leadership on this and other issues. Most of you know that the Texas Public Policy Foundation is a nonpartisan research institute founded 20 years ago to provide the intellectual ammunition for a better Texas. 4 years ago, the foundation launched our Center for Healthcare Policy Studies. Then, with Health and Human Services swallowing almost 1/3 of our state budget, Medicaid at that point costing $800 for every man, woman, and child in Texas, we believed that we were on a collision course with other state priorities such as education and transportation, and that it was time to fully engage in the debate in Texas. With the onset of the national health care debate this past spring, and with its potentially devastating effect on the Texas economy, we asked some of our nation's top economists at Arduin, Laffer, and Moore to perform an in-depth analysis of what Washington's current healthcare priorities would mean for our country and specifically for Texas. An interesting side note is that we also coordinated this research with 10 other states from around the country, and they are simultaneously releasing their research this week and next week as well. 2 weeks ago, we released the national paper, which focused specifically on this country and not on Texas or any state. We received nationwide coverage in the Wall Street Journal, CNBC, CNN, and Fox News. Today, we are here to release the Texas-specific findings, and the results are troubling. To talk about that is one of the economists from Arduin, Laffer, and Moore, the chief economist, Donna Arduin. She has provided economic, fiscal, and policy advice to governors, legislatures, and think tanks throughout the country. She is one of the leading economists looking at state and local governments and has served in the administrations of governors in Florida, New York, Michigan, and California. A graduate of Duke University, she graduated magna cum laude with honors in economics and public policy. Donna Arduin.
Thank you. Thank you all for being here. This is such an important issue, and I appreciate Texas Public Policy and other think tanks around the country being concerned about this issue, because it is going to have a significant impact not only on state budgets, but on all Texans. You may not be surprised to hear that history has a tendency to repeat itself. not just in history, but in economics. And government involvement in the economy has always, historically always, led to higher costs and lower economic output. Our study that I think you all have today was created to create a lens through which the healthcare policies in Washington could be viewed to determine what was going to be the outcome of these various proposals on healthcare costs and also the effects on our economy. We've concluded that the proposals moving through Congress fail to address the primary driver of healthcare costs, and it's something that we call the healthcare wedge. Let me explain. A wedge is an economic term that means it reflects the separation between patients, or any consumer, in this case patients, and healthcare providers. The separation between what a provider actually pays to provide a service and what a patient sees as their own costs. There has been a growing and significantly large healthcare wedge in this country. If you look at the report, beginning with with government involvement in healthcare, back with the onslaught, beginnings of Medicaid and Medicare in particular. And as you look through the report, there's clear evidence that government involvement in those programs created what we call a wedge, which led to high healthcare inflation. Healthcare inflation means you're spending more, but you're not getting more. Other things that cause the large and growing wedge in healthcare market in this country also include those things that separate the doctor and patient in their cost relationship as well as their decision-making relationship, like medical malpractice decisions, the impact of having, rather than individual-based policies, employer-based policies. Also government interference in the healthcare insurance markets themselves. All of this wedge that we talk about has led to inefficiencies that total, we estimate, about $700 billion of a $2.4 trillion industry. There's also evidence you'll see in the paper of the growing wedge between this relationship between healthcare providers and patients as evidenced by out-of-pocket costs. Just one tidbit from the study, you'll see back in the 1950s, out-of-pocket costs totaled over 50% of a patient's healthcare expenditures. That number's down to almost 10% today. So healthcare reform, we've determined, should be based on policies then that diminish this wedge in the relationship between patient and provider, not those that increase the wedge. Well, healthcare subsidies increase wedges. We've determined that $1 trillion in additional subsidies will weaken the economy. We estimate that in 10 years from now, the economy, GDP will grow by 5% less than it would have otherwise. That $1 trillion in subsidies will increase the federal deficit. 2019, we estimate the deficit will be almost $300 billion higher than it would be otherwise. It's going to add cost to the Texas budget, potentially $10 to $30 billion of costs. I mean, think about that in terms of the size of your budget here. It's going to cost Texans, we estimate, over $4,200 for every man, woman, and child in Texas. Now, you heard the figures that Brooke was just talking about. $4,200 on top of what you're paying right now. It's going to lead to job losses. It's going to penalize the 70% of Americans who are satisfied with their health care arrangements. It's still going to leave 30 million people uninsured in this country. To sum up, increased government involvement in the health care market is going to lead to higher costs and lower quality. So we suggest in the report that Congress should be instead focusing on those reforms that diminish the doctor-patient wedge. And if you look at page 25 in the study, you'll see some of those suggestions. So by empowering, just to leave on a positive note, if we could do those things and empower patients and providers to manage their own health care costs, you could improve the health care system, you could control costs, and you could increase economic activity. But that's not what we're seeing in Washington today.